So we do this so that we can make it available on our website after the fact for folks who might have missed it or who want to revisit the content. So I'm just going to quickly go over the functionality of WebEx webinars in case anyone is unfamiliar. Firstly, you can turn on closed captioning by clicking the CC button at the bottom left-hand corner of your screen if you wish to do that. You can also change the layout, so what you're looking at, by clicking the layout button at the top right-hand corner of your screen. You can raise your hand or do a thumbs up by clicking either the hand or the smiley face buttons at the bottom center of your screen. But please note that you can't unmute yourself, so if you would prefer to speak a question aloud, just raise your hand and I can unmute you. And finally, you can access the chat at the bottom right-hand corner of your screen, and there will be an opportunity for questions at the end of the presentation. So feel free to use the chat to pose those questions if you don't prefer to speak them aloud. And with that, I'm going to turn it over to Angus. I'm going to stop sharing. And Angus, you can go ahead.
Okay, thank you. Okay. Can you see the slide deck?
Yeah, looks good, Angus.
All right, perfect. Thanks for the introduction. Hi, everyone. I'm Angus Chisholm, Manager of Data Lab Solutions, and together with Kendra Lester, Manager of Data and Information Services Requests, we'll be discussing the Data Lab and the processes for requesting access to data. We'll get into a demo of the environment and show you what to expect once you're in there and field any questions you might have about the Data Lab. So what is the Data Lab? Essentially, it's a secure environment where users can interact with data and information in a privacy protective manner. Just to add a bit of background and context, NLCHI has been providing access to data for a number of years, but with the increasing demands from the researcher community to access health system data and the complexity of the requests and sensitive nature of data, there was a need to create a secure space to reduce the risk of data disclosure. So the Data Lab, and specifically the secure external research and evaluation environment, provides that safe work environment for researchers. So this is a bit of a busy slide, but I'll give a treetops view of how data moves from left to right, from source data on the left through NLCHI middle to data consumers and stakeholders on the right. So on the left-hand column, we have our data sources and various health system data sources ingested into NLCHI. So for example, we have health information system data, we have community and primary care data, we have electronic health record data, so drug information system, 100% of the community pharmacies are contributing data to our data warehouse. And more recently, in the last couple of years, ingested a lot of COVID-related data. So contact tracing data, travel declaration data, flu and COVID immunization data has been streaming for years now. So we acquired the data in NLCHI, and we have a team that's involved in acquiring the data, modeling the data. We transform, standardize, and in some cases, de-identify the data if that's needed. Once the data is prepped, along to the data access and distribution column, we make this available to various stakeholders. So you can see on the top, up on the top right here, we have many BI products, dashboards, and reports that we make available to healthcare system stakeholders across the province. middle section here, we have our secure R&D environment, secure environments that we make available to academia and external researchers. And this is really going to be the focus of our talk today. Secure R&D research and evaluation environment. And then on the bottom, we have a data stream whereby we acquire data, consolidate it, make it available to various, on the right here, eHealth systems, eHealth viewers and portals. So the main takeaway here is that there are a lot of services within NLCHI in the middle here that are involved in making data, prepping data, and making that data available to stakeholders. Secure R&D environment within the Data Lab is just one of those services in a much broader data management landscape. Okay, so this is the visual that depicts the various components of the Data Lab. Mentioned on the first slide, so that the Data Lab it's defined as a secure data environment, which it is, that's true. But there's also many different components and services and processes involved in making data accessible in a secure manner. And so I'll briefly go over these. Starting at the bottom, we have the data layer. So this is like our foundation. This is the base of the Data Lab, our provincial data warehouse. This is where we acquire our eHealth system data, get it available for use. Top of the data layer, number 2, we have a data access and release gateway. So before the data enters various environments, the identification processes and extract review processes, and then that can be made available to, on top of number 2, we have the various environments for accessing the data. And on the far left, number 3, we have our internal data and analytics environment. So this is a secure data space. And it's very similar to number 4, external research and evaluation environment. They both utilize VDI, virtual desktop infrastructure, and house similar statistical and analytical software. So we have SAS, SPSS, Python, other software applications available for use. And then continuing right, we have our business intelligence and reporting solution. We also have a machine learning space, HPC, high performance computing cloud offering. And on top of all of this, we have our Data Lab access portal. So this is a website. Users can browse a data catalog, get information about how to access the Data Lab, and other details about NLCHI in general. So that's a bit of background about the Data Lab, the components within the Data Lab. Hand it over to Kendra to go over the process for accessing the Data Lab.
Excellent. Thanks, Angus. So as a first step, researchers will need to acquire approvals for access to data for secondary use. So before we really dive into some more detail about the functionality of the Data Lab or the research and evaluation environment that Angus was mentioning, I just wanted to take a couple of minutes to review the provincial processes for accessing health data for secondary use in the province, particularly for the purposes of doing research. Perfect. So generally speaking, in order to conduct health research in Newfoundland and Labrador, you first need to have approval from the HREB. So that's the Health Research Ethics Board, which is our provincial ethics body. And of course, if your project involves the secondary use of health data, you're also going to need approval from the appropriate data custodians. So the first step is your ethics approval. And as part of that application process, a relatively new piece of the process, I guess, is that researchers will need to complete a variable list to identify what data elements they're hoping to use in their analysis. So, as I'm sure many people on the call can imagine, having to navigate the wealth of health data that exists in the province can certainly feel like a massive undertaking, especially when you're tasked with creating this variable list to submit with your ethics application. So, in an effort to help make this a streamlined process, the Centre for Health Information offers a data navigation service on behalf of the Centre, but also the 4 regional health authorities. And this, the purpose of this service is really to help researchers identify what data are available that can help them answer their research questions, as well as who the appropriate custodians would be of those data sets. So, it's possible that all of the data an individual is requesting could be held by a single custodian, but oftentimes there are multiple custodians involved in a data request. So you really can connect with the data navigation service at any time. So, anyone on the call who maybe is almost ready to submit ethics and hasn't connected with the data navigation service and wants to, it certainly isn't too late. But we do encourage researchers to reach out as early as possible, as we just find that's more helpful as you're writing your proposal, and trying to draft your research questions and objectives. And of course, on the slide here, I do have the email address there for our data access service. So it is just dataaccess@nlchi.nl.ca. Oh, excellent. Sorry, my slides are just a little bit out of order there. So just to give you an idea of the types of data held by the Centre, and Angus, I think, already touched on this in one of his previous slides, but this slide really is just a high-level overview of the types of administrative data held by the Centre. Recognizing this may not be an exhaustive list, but it certainly is representative of some of the data sets that we are asked for access to the most regularly. So these are the data sources, as an example, that you might discuss in detail as part of that data navigation service. So just looking at kind of the buckets we've created here, we have data around health service delivery and administration. So there we're talking about MCP, fee-for-service billings, emergency department data, hospital discharges. We also have data for the Newfoundland and Labrador prescription drug program. And we also receive data from the laboratories across the province, as well as medical imaging. With respect to surveillance, we do have a number of data sets available as well. So we are the custodians for the Provincial Chronic Disease Registry, which contributes to a larger national surveillance, the Canadian Chronic Disease Surveillance System. We also have a suicide database for the province. Also the pharmacy network, which Angus mentioned, and that contains information from 100% of community pharmacies across the province. And of course, some vaccination data as well. With respect to vital events, we do have live birth and stillbirth data, as well as mortality. And we also receive some survey data, so data from the census, as well as the Canadian Tobacco, Alcohol, and Drug Survey. So really the end product of the consultation with the data navigation service is the data custodian variable list. So I've just got, a blank copy of the first page of the variable list document up on the screen here. And this is available on the ethics portal, or of course, if you reach out, we can certainly provide you a copy. So the intention here is that the data custodians, once this document is complete, will sign this list to indicate that the data being requested is available, thus confirming the feasibility of the project. Just want to make an important note here too, that the data custodians, when we sign these variable lists, it really is not a formal approval to access the data. It really is just signifying that the data is available and that the project is feasible, but formal approval will still need to be obtained. And also, we will coordinate having the custodian variable list signed on behalf of the custodian. So the researchers don't need to take that on themselves. We can coordinate that in the background on our end. So the signed variable list then gets submitted to the ethics board. And once you have approval from ethics, that is when you submit your common application form to the data custodians for review and approval. And you'll know who you'll need to submit to because they'll all be listed on your variable list here. So I just want to reiterate that, while this is a data navigation service, we're also here to support you along your secondary use journey. So recognizing that we work in this space and the process is quite clear for us, but it's not always that way for researchers, particularly if you've not engaged in research before, if it's been a long time. So the data navigation service can also help if you have any questions about how to get the appropriate approvals and what order you need to submit certain documentation in. So please don't ever hesitate to reach out with any questions. Right. So the final piece that I'm going to touch on before I hand it back to Angus is around the data lifecycle. And so any applications that you submit to the Provincial Ethics Board, as well as to data custodians, are going to require researchers to have a plan in place for the storage, retention, and eventual destruction of the data that they're going to be receiving. So you will be asked to kind of outline all of those steps in detail in the applications. So just some traditional storage methods that we've seen, particularly before the creation of the data lab, was statements like a secure server at MUN in a password protected folder, or that data would be stored on an encrypted USB drive. So in both of those examples, the PI for the study would actually assume responsibility for the data extract, meaning that they would be responsible for ensuring that data is stored as was approved, that it would only be accessed by the approved users, that data was retained for the approved amount of time, and also destroyed properly at the end of the retention period. And as you can imagine, that could be quite a large undertaking if you have a number of graduate students who are starting programs at different times, or a number of research projects. It is a lot to manage, and it is a big responsibility as well. So NLCHI's Provincial Data Lab, specifically our research and evaluation environment course, enables secure access to data, but also takes the responsibility of storage, retention, and destruction away from the PI. So really, this is a big win for the center as a data custodian, because we have responsibilities for the data that we disclose, but also it's a big win for the research team and for the PI.
Okay, thanks, Kendra. So this is, we'll go over what happens after approval. So step number one, the researcher goes through the application process and approval is granted. So now we're ready to prep the environment for data access. And this, depending on the request, could involve data that exists in our provincial data warehouse, or perhaps it's in another data source or data holding in NLCHI. Or oftentimes researchers will have a cohort or researcher collected data that we'll ingest in through a secure file transfer. And then our data lab team will link the data, prep the data according to requester's data variable list. And then we'll make that available move it into the external RNE environment and place it in the appropriate project folder for access for the researcher. So once the researcher receives their credentials and gains access to the RNE environment, they'll log in, and when they navigate to their folder, project folder, the prep data will be there waiting for them. So what tools are available in the data lab? So the external RNE environment, we have many different analytical tools. We have R, Python, SPSS, Microsoft suite of tools. Lots of researchers use Excel. And these are all used for analyzing and generating the data products. And once the approval process, once you gain approval, we have a user guide that we distribute to researchers. And there's also a one-pager, sort of a highlight of the environment, how to access, and different tools that are available. And this is the one-pager, maybe a little bit hard to see, but I'll go through these just briefly. So up top, we have methods of access. So there's two ways you can access the secure RNE environment. It's a VDI environment, so you can either download the VMware client or access via browser. And I would say most users access via the browser approach. So it's research.healthynow.ca. And then that brings you to the login prompt. And we're in a secure environment, we're utilizing two-factor authentication. So the first prompt you're going to get is a token prompt. So everyone that accesses the environment will have an Entrust soft token, and they enter their token, enter their username, password, and then this gets you to number 3 here, Windows 10 virtual desktop. And when you access your desktop, you'll have a private drive and a shared drive. So if you're a researcher that's part of a team, let's say there's 3 or 4 other members on your project team, you can use that shared drive to collaborate, drop files, and the whole team can access that shared drive. 4 here, so when we set up the environment and the folders, it's typically named, or the standard naming convention is whatever your project is, that's what you're going to see as your folder title. And then we just have some highlights on, what tools are available. Again, our studio, our console, lots of Python programs, modules available. Lots of users like to use IBM SPSS. That's in the environment. And number 8, so there's, if you have a particular requirement to access database objects, then we can set up that database, and within the secure environment we have Oracle SQL Developer. You can write your queries against database objects. And then of course there's the Microsoft Office suite and finalizing our SaaS via implementation, so that'll be available soon as well. Okay, so let's do a demo. As a researcher, and log into the environment. So as I mentioned, it's research on healthynow.ca. This brings you to this prompt where you can either install the client or continue on with browser-based access. And the first prompt, so I'm going to log in with a test account, John Smith. We have to enter our token. And the second prompt is our username password. So then we get to our VMware landing page, and we click on our R&E desktop. This is going to load up our secure desktop. This is just going to look like a familiar desktop. So as I mentioned, every researcher gets 2. So there's a private drive, personal drive, and a shared drive. So for this researcher, John S., this was the project. This is just a demo test folder, but this is where we would find their first time logging in. They're going to come in and their data would be in this folder. So over on the left here, there's lots of shortcuts to different applications. Jupyter Lab or Python. We have Jupyter Lab, and lots of different ways to access and use Python. It's just going to bring up we have our studio and SPSS. This is a bit of a thicker client. It takes a minute to spark up, but I'll just go through the process of loading a file and walk through how you then get some products out for export. We also have SQL developer down here if you want to access via directly to a database. So we come in here and we navigate to our S drive. And load file. This is just test dummy data applications. And do something basic here, run a frequency, TC codes. And let's say we want to save this product then and export it out of the environment. So every researcher, research team group will have within their project folder files to export. And just save this one there. And now there's a process for contacting info services and notifying that there's a file ready for export, and a member of the Data Lab team then go in, securely transfer that file to the researcher. So that's basically a couple of key things, I guess, to note. It's a VDI environment, so it's a desktop. You can notice down here, there's no internet access. What you do in here stays in here, and it goes through that gating process to get products out. So you can't, for example, copy data to your desktop or to your local drive. That's all secure by design. So if we go, we just sign off. Disconnect us from our desktop session. So VMware as well. Okay. So it's a very quick demo of RNA environment, the secure RNA environment. I hope it gives you some idea of what's available in there and the process of, accessing data. Data will be prepped, it'll be there waiting for you. And if you want any products to leave, a simple manner of dropping that in the folder to be securely transferred to you. So I'll hand it back over to Kendra.
Excellent. Thanks so much, Angus. So now that we've kind of gone over the overview of how the Data Lab functions, as well as getting to see the demo, hopefully a lot of the benefits of the Provincial Data Lab are pretty clear, but I just really want to drive home some of the main benefits, particularly, I think, from our perspective as a Centre for Health Information, but also some that I think are going to really hit home for anyone who's been engaged in research in the province. So first of all, as you've just seen, it is a secure virtual environment, and it can be accessed from any computer with internet access, also within Canada. So we are limited to Canada right now with access to the Data Lab. And for added security and user identification, there's a two-factor authentication. So that is that passcode that you saw Angus go through in the demo. Also, we are providing users with access to statistical software such as SPSS, R, and Python, as well as Microsoft Office. And I know Angus just pulled up Python as an example in the demo, and anyone who might be familiar in coding in R or Python probably knows that you have to download different packages in order to perform different statistical analyses. And it is a closed environment, meaning there's no internet access. So we can add whatever packages you might think that you'll need into the environment for you. So that is one of the questions we'll go through as we're kind of vetting access to the Data Lab, is asking what you would require for your project. Also, I think one of my favorite features, personally, having been involved in research before, is how the Data Lab easily enables collaboration. So as again, you've seen in the demo now, the data are made available in a shared folder that is accessible to all approved project team members. And so again, remembering that we do have access anywhere in Canada. So one thing that the Data Lab really opens up, in my opinion, for people engaged in research in the province is the ability to easily collaborate with colleagues across Canada where you may not have been able to do so before. So they could come into the environment, they could either participate in the analysis, review results within the environment, you know, and just really easily collaborate in that way. But also, I think it's a big win too for students and trainees. So any graduate students or any medical residents that are engaged in research and maybe they, you know, have an opportunity to do some training outside of the province, you know, historically they may have had to kind of leave the research behind or, you know, put an encrypted USB in their pocket, which is not ideal and would not certainly be recommended for anyone to do that. So this would really enable better, I guess, continuance of a research project and enable them to remain engaged while they are outside of the province. Also, while the record level data would have to live in the data lab in the R&E environment, you can export any aggregated results, or, you know, if you do choose to write a manuscript or draft a presentation within the data lab, all of those, you know, information products, I guess you could call them, can be exported out of the environment and sent to the research team. Also, as I kind of had alluded to earlier in the presentation when we were speaking about the data lifecycle, working within the R&E environment really shifts that responsibility for security and retention and eventual destruction of the data to NLCHI. So, you know, obviously that is through communication with the research team about the length of time for retention. You know, those details will all get teased out through your application processes, but it kind of shifts that, that responsibility to the center. And also, I know I've mentioned this a few times now, but again, you can access the data lab anywhere in Canada where you do have internet access. So I think that's important to share as well. And finally, so while Angus and I have had the pleasure today of presenting to the group and I guess kind of being the face of the data lab as part of this presentation today, it was really important to both of us that we take the time to recognize all of the hard work that went into building the data lab and in making it operational. So listed here on the slide are various departments and divisions within the center that played a key role in developing the data lab and in maintaining it, of course. You know, we really do have a fantastic and talented team at NLCHI, and this is a really big initiative for us. So we're very proud of it and proud of everyone's work and coming together. Also, just wanted to recognize ACOA, the Atlantic Canada Opportunities Agency, for the funding that they did provide in order to support the building of the data lab. And yeah, so that's it for the presentation portion, I suppose. And just on the last slide here, you'll see the email address for info requests at nlchi.nl.ca. So if you have questions about the data lab, certainly reach out to that email address. And of course, we do have our data navigation service, which we did reference earlier. But we all know each other here. So if you reach out to info requests, we'll redirect you if required as well.
Thanks, Kendra. And I mean, I think if you are okay sharing the slides with me after the fact, I can include any relevant links and whatever in a follow-up email.
Perfect.
Happy to do that.
Yeah, thanks very much, Chelsea. That would be great.
I think we have some time now for questions. So if anyone has a question, you can feel free to type it into the chat. Or if you prefer to speak it aloud, just raise your hand and I'm happy to unmute you. That it seems like so convenient, honestly. Just amazing, really.
Yeah, no, it's been great. And I think one thing that we didn't mention during the presentation is the fact that we have actually had 30 projects coming through in various stages. Some are complete, some are in progress. And also that was 30 projects, but 88 users. So as you can see, a lot of users on multiple projects and you know, teams obviously that consists of multiple people. So, you know, it certainly has been getting a lot of use and we've had a lot of really great feedback as well.
Excellent. I see Peter has his hand raised. So Peter, I think you should be able to.
Thanks for that. Really big improvement in data flow in the province. No question, this is helping researchers do good research. And we're referring residents from our training program to do their research through this as well. Yeah, great service. One of the concerns is the speed, and we really do struggle with months of delay around some of our requests. So, super big improvement. I'm not complaining, but we really would love to see a lot faster turnaround through it in NLCHI. Thank you.
Thanks, Peter.
Thanks for your comment, Peter. I don't know if Angus or Kendra, if you have anything to add to that.
You go ahead, Angus. Yeah.
Well, I guess I just offer that it's end to end the process from when you start request to when we receive a variable list. There can be multiple, I guess, checkpoints in there where it's back and forth, and that takes a bit of time to get the approvals in place for sure. But yeah, I mean, we have a team of experienced resources. Once we get a data variable list, we can link that and make that available in very short order. And it's the feedback that we've received from users in the environment is it's when you're in there working and you need a product out, and that's very efficient as well. So I think there's lots of benefits and lots of positive experiences we've been hearing so far.
Absolutely. There's a few questions in the chat here. Oliver asks, is this a free service?
Oh, excellent. Yeah, so as of right now, we are still finalizing a costing model for the data lab, where we did prioritize a costing model for private sector or commercial type or requests that come from individuals looking to commercialize on data. So we are almost, we're almost there with getting that piece finalized, and then we'll move on to a fee model for the data lab itself. However, anyone who's worked with the center in the past from the research world knows that we don't want to see that be a burden to anyone or a hurdle. So certainly reach out anytime you have a project. But as of right now, there is no fee for researchers accessing the environment.
Thanks, Kendra. Alicia asks, if I'm using the data lab and end up needing to add someone to the project team and give them access, can I do that? And how does this process work?
Yes, absolutely. So your team obviously will change over time or can change over time. So if you do need to add project team members, that would be a personnel amendment with ethics. And once you have your personnel amendment approved, you can just send a copy of that to the info request email, and then we can get them a user account and set them up with their credentials.
Excellent. Are there any other questions? I have a question. I don't know if either of you are the appropriate person to ask the question to, but I'll ask it anyways and see what comes up. So just think, when you were presenting, I was just thinking, I think it was Angus who shared a slide about the different, oh no, Kendra, it was you, about the different kinds of data that you have access to and that you can provide access to. And now that we're starting to think more about the social determinants of health and this broader idea of well-being and health, is NLCHI considering gaining access to different data sets or different types of data that they can provide to researchers, I guess, to support that?
Yeah, no, that is certainly an excellent question and a hot topic right now. So, social determinants of health data, I think, have kind of always been on the radar, but I think that the final reports in the blueprint that were shared from the Health Accord are hopefully going to push that along a little bit further. So while, there are some talks, nothing is certainly set in stone right now, but hoping that we'll be able to bring some of that data together, because that does add a whole other important lens on data, particularly health data, when you're running any kind of analysis or research project. So I guess stay tuned, and no doubt as we start to acquire additional data sources, hopefully we'll be able to come back to this seminar and to others and to share, let people know what we have and what could be shared for secondary use purposes.
Thanks, Kendra. I see Oliver has some more questions here. How do we upload data from external sources? And I'll let you answer, and then I'll ask the next one, I guess.
Okay, excellent. So if you do have data, and I guess to clarify too, it isn't just data, it could be a previous code that you've used, like recognizing people have been working not in the data lab for quite some time and developing their own code and processes and things like that. So if you do have any code that you need to bring in or data, there is a process for that. So we have a secure file transfer system. So you would have to identify to us, obviously, that you had something you wanted to bring into the environment. We would be able to then set up the secure file transfer, and obviously scan everything that comes in to make sure everything is safe and secure. And then we would put it into your data folders for you. So there is a pretty streamlined process for that in place.
Great. And can researchers retain access to the VMs while they are between projects?
Right. So I guess that means, can you still log in? Yeah, absolutely. So I guess, I mean, yes, like there's no, as of right now, no one's account is expiring. And the data lab hasn't been operational enough for us to get through someone's full 5-year retention period. So we haven't actually put that part of it into action yet. But if anyone still had an active project, so if you're on multiple projects, you certainly wouldn't have your account be decommissioned. But in the event that your account was ever, if you tried to log in and couldn't gain access, you just have to reach out. We'll have your account reset. So I guess yes, but in the event that it doesn't play out that way, we can certainly reset the account. It wouldn't be, a whole creation of a new user identity for you. We would just be able to reactivate.
Great. And finally, is there a warning prior to data deletion?
Oh my goodness, yes. So we certainly wouldn't do that. And I guess really the reality is when people, or typically, I should say, this is the typical case, the retention period that we usually see coming through from ethics or approved by ethics is 5 years post publication. So there has to be that back and forth period where, we discuss, okay, what is the actual 5-year period? Like when did your analysis complete? So when the time came to actually destroy the data at the end of that time period, we would reach out to the PI, really only the PI. If we didn't get a response, we would move on to the rest of the research team just to try to get an idea of where it is. But yeah, we would never delete any information or any data without letting you know.
That's good news, I'm sure.
Yeah. No, don't worry. We wouldn't go doing that on you.
I have a question, I guess, if no one else is jumping in here, about public access to the data lab. Now, I know, like, if we're thinking of the general public, they might not have the skills necessary to do all the analysis that is available in that space. But especially in my work, where we're encouraging folks to partner with patients on their research teams at a very high level, and in some cases for patients to lead that research, is that an option?
Yeah, so you would identify in your ethics application and in your applications to the data custodians who are the approved project team members and who will need access to the data and why. So there is no requirement necessarily to be affiliated with MUN if you're an approved project team member, and the record level data, like all of that data, is staying within the environment. So that should be allowable as long as they're on your ethics application, which I suspect they probably would be.
Yeah. And I imagine maybe they would need tri-council policy training or something like that.
Well, yeah, those requirements, are built into the application processes. So, having the tri-council training as part of ethics, and we would require FIA training as well from the custodian perspective.
Thanks for the clarification, Kendra. Does anyone else have any questions? Oh, Joni, let me unmute you there. Does that work?
Okay, can you hear me now?
Yes, perfect.
Okay, yeah, I'm thinking more on the patient partner perspective of access to this data and even where I'm working with community. So this is the secure internal environment where researchers would work, but is there a kind of platform outside it that the general public can see? Just things like, we're always being told we have the highest rates of chronic disease, and I guess some of the kind of statistics and facts that were in the health accord, and data broke down by region of you know, I think that would be really helpful for members of the general public. You have all this data, and I'm thinking that's wonderful. I'd love to get at it, but I could never navigate that system. I would get a researcher to do all that for me. But in terms of like talking to my patients and talking to community the way I do, I think they would love to see a way that they could go look at pictures of things, you know, and have it on a much more simplified level for them.
Yeah, no, that's fair. And I guess just before I kind of get to answering that part of your question, just to clarify how the data exists in the data lab, it is an extract, so you're not actually you know, hitting our systems, or you don't have full access to all of the health data holdings. It would be an extract of the data. But to your point, Joan, we don't really have an environment right now where people can kind of go in and easily access that information. We do have, of course, an information request process where anyone, public, someone who's a researcher, you know, someone who's working within the health system, can request aggregate level data. So they can request things like, you know, the rate of diabetes in the province, as an example. And, you know, while there's no immediate plan right now to be publishing that widely, I do think that is one of the outcomes of the Health Accord, is to make some of that data a little bit more transparent. So hopefully we'll see some of that coming up in the future. But if there is anything that you or anyone, you know, may be interested in knowing, certainly reach out. Like, we can provide that aggregate level information as well.
Okay, thank you very much.
Yeah.
Does anybody else have any other questions? I might take over screen sharing here, Angus, if that's okay. Good. So thank you both very much for coming. We still do have time, so if someone does have a burning question, please interrupt me with it. No problem there. But of course, I'm sure Kendra and Angus would be happy to receive your questions via email after the fact as well. And you're welcome to email me, and I'll show my email address in a second here if you'd like to contact them. But thank you both very much for joining us today. As I mentioned, the presentation will be made available on our website, usually within a week or so. So if you want to revisit this or revisit any of the links that were shared, then you can absolutely go and take a look at that. And just, whoops, there you go. Just to let you know, a few feedback questions will pop up on your screen immediately when you close this window. So if you do have a minute, please, we really appreciate your answers to those questions so that we can continue to improve our free training program. And as always, and as I mentioned, I'm always available to answer any questions that you have. So please email me. My email is there on the screen. You can also follow us on Facebook and visit our website to stay up to date on our upcoming training sessions. On February 28th, Quality of Care NL is hosting the second webinar in their Healthy Discussions series. And that discussion will be about food insecurity, and will feature Josh Smee, the CEO of Food First NL. We also have our 2023 Research Design Series continuing this month, though dates might be impacted by the current MUNFA strike. So just keep an eye on our website for those. And thank you very much to all of you for joining us today. If nobody has any questions, I'll say have a happy afternoon and happy Friday.
Thanks, everyone. And thank you for inviting us to present to the group today.
Thanks, everyone.
Thank you. Bye.